Hi, I'm Mariah Hahn, and I'm a tissue engineer. What I love about tissue engineering is it has such a great potential to help save lives or reduce pain that people are experiencing on a daily basis. For instance, there's a large number of people on the organ transplant waiting list who will never receive transplants, who will die before those transplants happen. And tissue engineering is a way to potentially get tissue that can save these people's lives. And also there are people who suffer from chronic pain on a daily basis, for example, in their joints. And right now often what's done is total knee replacement. But what if we could replace that with a living tissue, something that wouldn't need replacement, because knee replacements need to be done again after about 10 to 15 years. So you have what are called revision surgeries. What if we had a living tissue that would grow and change with the patient while also dealing with the pain that they experience? And so that's part of the promise that tissue engineering holds. My research focuses on trying to regenerate bone, vascular, and vocal fold tissues. And in essence, what we're trying to do is design instructive materials that will guide cells to regenerate diseased or damaged tissues. One specific project I'm working on is coronary artery bypass grafts. And currently what's done in those cases for people who have diseased or damaged coronary arteries is grafts are taken from the mammary artery or saphenous vein. But unfortunately, some patients are not in good enough health. Their veins are not healthy, their arteries are not healthy, and so taking a graft from the patient is just not really feasible. In those cases, synthetic grafts are used. For example, Teflon is used as a graft material. And those tend to close with time. It's called their patency. They don't have good long-term patency. And as a result, if we could have a tissue that was living, a living replacement for that tissue, which again would grow and be modified with that human, that would be a significant advance in those treating coronary artery bypass conditions. In terms of what I'm looking for in students or postdocs, is not what you might at first expect. And actually, no previous training in tissue engineering is required. But what is required is a drive for excellence, an attitude that embraces continual learning, and the persistence to continue working hard in the face of obstacles. So those are the things we really look for. And also, we like to have fun.